Looking at this projection of deaths per day in the United States, if it matches a 3.8-day doubling time and the containment measures on March 22nd were sufficient to bring it down to a 5-day doubling time after that point, then we're locked in for a 17,500 person death toll by April 9th. But even at having 500 people a day dying at the 31st of May, will be difficult to tally the total numbers of dead, so the martial law will probably be declared sometime on or before April Fool's Day. The hospitals should be at capacity by April 4th, whereas by about April 7th, gymnasiums and auditoriums will need to be employed primarily for housing the pneumonia patients. On April 7th also, the ICUs should be just about at capacity, but able to stretch capacity for 2 or 3 more days until eventually on April 11th, they'll have to turn people away entirely, and those numbers will get added to the death toll per day, which will spike the total number of dead to about 100,000 by April 14th, and then gaining about 100,000 deaths per day after that point. The minimum death toll, assuming that these containment measures on the 22nd of March were nearly perfect, is still locked in at 17,500 people. It's not necessary to determine the total number of people that have contracted the coronavirus, because the majority of cases will be asymptomatic, and the thing that we're trying to understand is when the hospitals will be overburdened and by how much, because then we know what the impact will be on civilization and how long quarantine might last. As long as we know what percentage of people who enter the hospital for pneumonia end up needing to go to intensive care, and what percentage of those people in intensive care end up dying, then we can work backwards and extrapolate from current deaths approximately how many people must have been admitted to the hospital. This data from the CDC and the WHO will set the conditions for our initial calculations. And we'll compare our situation with that of Italy because of the similarities in the abundance of data. This is the timeline of the corona development in the United States, shown in more deaths than the day before. If we match that up with Italy, you can see that our rate of growth corresponds pretty evenly to Italy at that point. So this is our response, and then this is their response calibrated. At the point that we closed schools and had many cases detected, they had 50,000 people in quarantine across 10 cities. At the point that we had one university close, they had an additional 500 police and more checkpoints in the red zone. When we had sports seasons canceled, they had many of their schools in the entire country closed. When the CDC recommended that 50 people not hang out together, they had a huge expansion of their quarantine zone and all social events canceled in the yellow zone. When we had 1,000 spring breakers flock to Florida, they had all schools in the entire country closed. And when we had Fauci say that you shouldn't get medical advice from the President of the United States, they had 60 million people in lockdown across the entire country, 100% of their population on lockdown. Then we finally locked our country down at the point that they were tightening the last little bits of lockdown in their country, and then they declared martial law in their country of what would be about April 2nd in ours. Now you can see the American progression of deaths over this series of days, new deaths each day, and we're going to model it against these doubling times. Now I could say that it comes out pretty close to a 2-day doubling time, but we're going to go for the 2.2-day doubling time that's right in the middle of these extremes. At a 2.2-day doubling time, that leaves 1 million people dead by the middle of April. So I'm going to disregard the 2.2 day doubling time. Instead, I'm going to use the 3.8 day doubling time, which is the most conservative estimate for what Italy's entire progression fits into. Assuming that we did better than Italy in our response, we'll use this metric. So that is to say that people that contracted the disease on this day were hospitalized on this day, died on this day, so that this value of deaths accounts for this number of people entering the hospital on that day. This is the total number of people in the hospital. So now you can see that because this number of people died on this day, this number of people had to have been hospitalized on that day, having contracted it on that day, and that out of this number of people, 0.3 of them went into the ICU, shown here on this day. So now we add on the dead, and we have people that contracted the disease on this day, get hospitalized on this day, they go into the ICU on this day, and then those people die on this day. Once we establish that the relationship between hospitalized and dead is 15%, then we know that the number of people that go into the ICU on this day is 30% of the number that go into the hospital on this day, and the number that die on this day is 50% of the number that go into the ICU on this day. So once we've established that relationship, you can see that the people who contract the virus on this day end up dying on this day. Whereas if you change the rate of growth of the virus on this day, this number of dead is locked in, and it will start to go down after that. So if you were to say that our containment measures became sufficient to reduce the rate of growth of the virus on yesterday when we locked down the whole country, and it went from 3.8 day doubling time to a 5-day doubling time. So let's see what that looks like. Now this is showing going from a 3.8 to a 5-day doubling time because of these measures of people going into the hospital. This is the total number of people in the hospital. This is the people going into the ICU. Now that one also went down because of those measures. And ever so slightly, and then this is the number of people in the ICU, but that also brought deaths down. But as you can see, if we reduce the number of people that contract the disease on this day, the number of people that die on this day is the same, 3,000 people in this day for 17,500 people total across the country, but it begins to go down, the rate of increase goes down after that point. So what are the flaws in these numbers? Well, the hospitals can't hold this number of people, and the ICUs can't hold this number of people. Really, the hospitals can hold about that many, and really the ICUs can hold maybe that many, let's say. Now, the number of people that get hospitalized can kind of go up a little bit, even though they're on cots in auditoriums and gymnasiums at that point. But the number of people in ICU doesn't increase because they need ventilator and specific equipment and things. You can see here that the number of people that can be in the ICU simultaneously is fixed, such that on this day, that was the last full increase of people coming into the ICU. So on this day, the ICU had filled up, and so they took their last 24,000 people. On this day, they could only take an additional 1,750 people because those are the beds that opened up once these people had recovered. Those people that recovered went into the ICU on this day. 50% of them died, 50% of them recovered, and their beds got taken over. So you can see here that the death toll jumps by the number of people that aren't able to go into the ICU. and it continues jumping every day by the number of people not able to go into the ICU. If we match the Italian response with the US response so that they're synced up, then we can see that they declared martial law on what would be here about approximately April Fool's Day. As far as accuracy of reporting, we know that it became really difficult for Italy to account for the dead in this time period. So that could account for the plateauing of this numbers kind of quickly, even though we know that they're hitting an exponential increase. It will be really difficult to get an accurate total of the dead after about March 30th, and certainly by about April 1st, which is the last point that we should expect martial law to have been declared. So a note on determining the total number of people in the hospital. The total on one day is the total from the previous day plus the new people entering the hospital minus the people that get transferred to the ICU, which is 30% of the total number of people entering the hospital 6 days earlier, and also minus the people that get sent home because they recovered, which is 70% of the people who entered the hospital 14 days earlier. And a note on determining the total number of people in the ICU. Each total is the total number from the day before plus the total number of people who come in that day minus the people who die, which is 50% of the people that were admitted 7 days earlier, and also minus the people who recovered, which are 50% of the people that came in 14 days earlier.